name's Dr. Brad Conder. I'm here with Larry. He's one of my longtime telehealth patients. Not too long, maybe about 2 months, I think. We've been working on his low back pain, which more specifically, he has what we call lumbar stenosis, or even sciatica, if you want to call it that, where he has a lot of pain down his legs, has been interrupted for all life as far as like golf, being able to walk. And Larry, are you okay for us to be on this video and share your story today?
I am indeed.
Okay. So all I want to be able to tell everyone out there that's watching this video is just to tell us a little bit about what your story about what you've had and what we've been able to do with these video sessions.
Well, over a year ago, whenever my back and lower back and leg problems started to occur, they were just a chronic issue of trying to figure out how to be able to get through the day. Simple things, sometimes just simply wanting to walk, or in my case, just wanting to play golf. And play golf, like I would play, because I'm not that good. I'm just a bogey golfer, but I enjoy doing it. And it's one of those recreations that when you take away in your life, it kind of diminishes your joy, is what it does. So in looking at all of the MRIs and everything else doctors will tell you and do, by trying to do these conferences, or at least these teleconferences, each week, once a week, or sometimes twice a week, kind of motivates you a little bit better to be able to actually get better. And considering today's environment, where everyone is now, or a lot of people are at home, and by hopefully their own choice to try to do the right thing for their neighbors, then this may be one of the biggest and best things that happens in physical therapy applications for the near future. That it works, and it works really well. Once everybody gets a little used to it, it takes about a couple of weeks or so. But once you do, you get into a routine, and it really does help a lot to be able to do that and help your back over a sustained period of time, or whatever other issues you have.
How confident are you that we will be able to get back to golf once golf season comes back around?
Oh heck, I'm close to 100% sure. I mean,
Yeah.
I will play. Let's put it that way. I'm stubborn enough to be able to make sure that happens. But I will play. It's a matter of how will I be able to play. Will I be able to play, like I used to play? That's the goal. Play like I used to play. Because I will be playing. It's just sometimes whenever you play with your back hurting, you don't play nearly as well as what you did before.
Well, for you having sciatica and these type of nerve problems, do you feel pretty confident that we've been able to take care of this without having the risk of surgery or anything really invasive?
Yeah, it's there was a time whenever I really did think that the only solution that I was going to have was going to be surgery. Just about like everybody else that you hear or think about or talk to that has it. And some can give you horror stories about what's happened with surgery. Some have had success with them. But inevitably, as we grow older, you always come back to having the problem again. And I see that in my friends as the ones that are also getting older. So it's a matter of, okay, what can we do to not start that ball down a steep curve of where you have one surgery, you think you're doing okay, time goes by a little bit, and boom, it happens again, that you have to have surgery again. And, I don't think anybody wants to really do that over an extended period of time, because then you're almost fighting battles what you're doing.
Yeah. So just to kind of finish up here, and I appreciate you doing this today, what would you say if someone is in your same experience as far as having this leg pain and back pain, what would be one of your main recommendations to them as it pertains to doing physical therapy?
One of the main issues that by doing this by teleconferencing or physical therapy by itself, what it can do is keep your spirits up a lot. It can physically help, and it will do all of that. It will do every bit of that. It really will, and it works. One of the bigger benefits that people, I think, will find is that when you have someone on a consistent basis asking you, how's your day? How was your weekend? What's going on in your life? Those mental things also that are happening can also influence how much you're willing to do therapy, do physical therapy, to get a little bit better, to have a better life. And those are the things that you look for in a physician or in anyone else who really cares. And how do they care? What services do they want to put out there? Those are the things you really want to look for.
Good.
So far,
well, I appreciate that. Well, we got a lot of work left to do today. I appreciate the interview. Hopefully this helps people make a decision as far as what they need to do moving forward. But we're going to continue to work hard to make sure we can play golf this year. So thanks for your time. And that's all we need for today.
my pleasure.